Thank you, Chair. Thank you for appearing tonight. I've got questions on gender, sex, change. My questions are to the Commissioner who looks at gender affirmation care and children. So I'm supposing that may be Dr. Cody, is that right?
That's correct. Thank you, Senator.
Thank you, Dr. Cody. I want to make clear from the start of these questions that I support adults doing whatever they like if they want to transition or attempt to transition. I draw the line, however, at children. Previously, the Commission has argued in court that puberty blockers were, quote, reversible. The risk of a wrong decision to give a child puberty blockers was, quote, low, and the outcome of a wrong decision would not be, quote, grave. My question to the Commission is, do they still stand by that position completely? And why the hell are you in court arguing to put children on puberty blockers?
Thank you, Senator. I believe that you're referring to family court decisions in which we have intervened as amicus. I'm not aware of the details of those specific cases. I would have to educate myself around exactly what our argument was. We do not have any intention to, or any cases that we are intervening as amicus or have sought to intervene as amicus in relation to the use of puberty blockers or gender-affirming care with children.
But your words are significant. Are you a medical doctor?
I'm not, Senator.
There's good evidence that puberty blockers are reversible. There's no good evidence that puberty blockers are reversible, and the effects of puberty blockers on the developing brain of a child are simply unknown. Why should the Australian taxpayer be funding the Commission to argue for children to make irreversible changes to their body that we have no good clinical evidence for?
One of the fundamental human rights that we all have is a right to health care, and that includes for children, and the importance of all children having the appropriate access to health care from the moment they are born right through until they turn 18. Gender-affirming health care is a part of that access to health care.
So, okay, let's continue. The Cass Review in the UK, have you heard of that?
I have, Senator.
Was one of the most sweeping and intensive inquiries into puberty blockers for children. The Cass Review said that the evidence for puberty blockers is so poor that they should be confined to ethically controlled clinical trials, and cross-sex hormones for minors should only be used with extreme caution. The Cass Review had the gender affirmation treatment protocol used at the Royal Children's Hospital of Medicine independently evaluated for the scientific rigour in development. Do you know what it scored, Dr. Cody?
I'm sorry, what scored? I didn't catch the first part of that question.
It had the gender affirmation treatment protocol used at the Royal Children's Hospital of Medicine independently evaluated for the scientific rigour in development. It scored 19 out of 100. Very low rigour. Are you aware that in the United States there was a $10 million US dollar report over 9 years that was not published because the lead author didn't want the results to be public? Those results were that there were no improvements in mental health of children who received puberty blockers after 2 years. Are you aware of that?
I'm not aware of that study in the United States. In relation to the Cass review, one of the findings of that review was recognising the importance of having a holistic approach to healthcare, which we have in Australia, which includes psychologist treatment, social work treatment, and having wraparound services with GP psychiatric assistance for any child who has any issues around their gender. So one of those recommendations is something that we actually have within Australia, and we're lucky to have within our healthcare system.
Until recently, it's been almost automatic in some areas to put children who suffer from gender dysphoria, which is not uncommon in adolescence, put them on affirmation, change their gender. I can't remember the name of the institute, but it's either the Australian New Zealand Society of Psychiatrists or Psychologists, but have come out recently saying gender affirmation is not recommended. When are you going to stop going to court at taxpayer expense arguing for these experimental, life-changing, irreversible, mentally damaging chemical treatments to be given to children?
At the moment, we're not intervening as amicus in any cases before the family court.
On your opening statement, thank you, Dr. Cody. I think this will probably go to the President. you say on your opening statement, human rights are the blueprint for a decent, dignified life for all. Human rights are the key to creating the kind of society we all want to live in. Could you tell me what is the field of human rights? What rights are encompassed in the field of human rights?
I guess the modern human rights movement started after World War II with the Universal Declaration of Human Rights, where the international community, after the horrors of World War II and the Holocaust, said no more. These are the basic standards that everyone, no matter who they are or where they are, need to lead a decent, dignified life. They have then been expressed in two key international treaties, the International Covenant on Civil and Political Rights and the International Covenant on Economic, Social and Cultural Rights, and various other treaties have codified aspects of rights since then. Those treaties have only been partly, or the human rights in those treaties have only been partly implemented in domestic Australian law, which is why we're calling for a Human Rights Act to properly implement Australia's international obligations and to properly protect people and communities' human rights in Australia. But is there a specific human right or aspect that I can address for you, Senator?
I'd just like to know what you see as the core human rights that humans have and that you're overseeing in this country.
The legislation that we have in terms of our discrimination laws implements the obligations to protect aspects of the right to equality. For example, we have 7 commissioners who 6 of the 7 are thematically focused on different rights. So Commissioner Cody obviously focused on equality rights. Commissioner Hollands focused on child rights. Commissioner Fitzgerald focused on the rights of older persons and the like. I guess the key international treaties are the International Covenant on Civil and Political Rights and the International Covenant on Economic, Social and Cultural Rights.
Senator Roberts, I don't want to interrupt this really helpful lecture on human rights law, but if you've got a punchline question, you should get to that now.
Is freedom of speech seen as a human right?
Yeah, good question.
Thank you.
So freedom of expression, freedom of speech is an aspect of that, freedom of peaceful assembly, freedom of religion and the like, critical human rights.
Thank you very much. Thank you, Chair.
Good question, Senator Roberts. That's all the questions